So write down your questions for Andy, and then I want to roll right into Joanna. Do you want to sit here? Sit there or come up here? What would you prefer?
I think if you only make me stand, that's kind of discriminatory
Okay, so
against
Joanna,
men.
would you like to join at the podium? And Allison, can we
Would you like
switch
the
to the
mobile
back
mic?
to my screen?
Yes.
Okay.
Great. There you go.
Thank you so much. And it's really a privilege as a lab scientist to be at the National Academy of Sciences. And it has been a great learning panel for me. And I'm going to try to say not to repeat myself too much, but to have my reflections also reflect some of the things that were said that perhaps I don't fully agree with or believe that we may act upon them in a different way than was suggested. So I've been working for 10 years on the Millennium Development Goals and started 2005. Why I'm saying that is that I came to the Millennium Development Goals from really basic science background and biomedical research, and everybody thought like, you are crazy, why are you going to work on this? And my motivation was that I had the luxury to make my own decisions. And I decided that I found it really unacceptable that at that time there were at least 2 million children dying of malaria in sub-Saharan Africa, while we at the same time knew how to prevent it and how to treat these children, so how to prevent it from happening. And I decided that this is really unacceptable, and I will try to see how I can use my science background to make the difference. So, of course, what was obvious for me, 2005, that was when the Millennium Project already launched its reports. So notice it took 5 years from the MDGs were adopted to actually have plans, very long period of time. And so I came into the project where the reports were already there, and I was told, why don't you talk to the scientific community? Why don't you talk to the private sector, how they can get engaged? And it was a very interesting experience, especially here in Washington, going to the leadership at NIH, going to NSF, going to Howard Hughes leadership, and mentioning that, well, this is the problem in Africa. We have children dying of malaria. We have all those different diseases. We need to stop that. What are you doing about it? And I was getting the same answer. Well, we don't do development. They couldn't even see the connection of their own work and research with the situation on the ground, and that their work needed to be translated into practice. It was very interesting. When I went to the private sector, there was a similar answer. We don't do development, but we have some foundations. Maybe we can help by, why would we do that? We are not a charitable institution. We are businesses. So we are not interested. And if they were giving money, or if some of the foundations were giving money, they would always ask the question, well, is this sustainable? It's not going to be sustainable to give people drugs or bed nets. How are we actually going to do that? So that was 2005. And I can feel proud that after 10 years, I've been part of a process where we actually have seen great accomplishments. That's just the fact that we had specific goals and timelines, and that the money, especially when it comes to the health goals, was invested, produced results. So we learned that if we define what's the problem, what are the different solutions, and we deploy evidence-based solutions, it doesn't work always. There are always challenges. We need to really get the countries involved, but it took many years, but it started to work. So that sustainable development for me started actually much, much earlier. It really started 2005. And I was at that time at the Earth Institute of Columbia University, where I spent 10 years, which is a center where everybody works on sustainable development. So that's why I would really like to respectfully disagree with Lisa that we need to educate the world about sustainable development. And the Sustainable Development Goals, there is a reason why they're called Sustainable Development Goals. So I know that even Richard Curtis probably may rethink, as a new SDG advocate of Secretary General, that his role as an advocate is to advocate for the Sustainable Development Goals, and we need to have a common narrative. So yes, it is difficult to communicate. It's like maybe Thrive may be difficult to communicate, but we need to find ways to educate people about sustainable development. And I don't feel we should be compromising on that. So we learned a lot from the MDGs, and I was very much involved in helping to put together a network on Sustainable Development Solutions Network to advise or in parallel work with the UN system. And that was such a great opportunity. It started 2012, where people were actually arguing, should we call them Sustainable Development Goals? No, we shouldn't, until we really got all the countries on board. And it was a long process. It took almost 3 years. And what was different now with the Sustainable Development Goals is that they were not just about them, that we are helping out there somewhere. They were all about us, all of us. And I think it took a while for people to recognize that. But the interesting part of my work was to realize that the private sector has been working on sustainable development for a while, for other reasons, not necessarily to make the world better, but for compliance reasons and other reasons, reputational reasons. So they have been thinking about it, and that was a great opportunity to actually bring some of the corporate leaders, like Paul Polman from Unilever, but we have also seen others getting really engaged from different sectors, different industry sectors in the SDGs. I think I heard yesterday Jan Eliasson, who is, I'm also a Swede, Deputy Secretary General, giving a speech, and he was saying for him the Sustainable Development Goals, he can translate it into one word, together. And I really liked it. So, you know, it's really, we have to be in it together, and it's about all of us. And the sentence, leaving no one behind, actually has a meaning. So our Millennium Development Goals, it's not like they are gone. We are just continuing, and they are really part of the first 6 goals. And we do need to continue to invest in them. So we should be, while we're talking about the SDGs, we should keep in mind that those issues didn't go away, and we still have to continue working on child survival. And when we talk about the financing of development, we need to continue the efforts, because it's very easy, or it takes a long time to build something. But especially when it comes to health, it doesn't take long time to really destroy it. The September 25th was an incredible moment for me to recognize that, oh my God, I never thought 2012 that it would be possible that everybody would agree on the Sustainable Development Goals. And yes, there are many. You know, you can package things differently. We have 17, probably we could have had 10. It doesn't really matter. They address all the issues. And I think that's what's important. The other very, very important thing that's what I was hearing today, that there is this fear that people will pick some of the goals and work on them. I think the other very important communication message is that they're all interdependent, all of them. It's not just a few of them, all of them are interdependent. And we need to take that really into consideration while planning, especially at the national level, but even at the local level. And so, you know, the fact that all the world leaders, so people say, oh, they are UN goals. No, they are not UN goals, because every head of state agreed on them. So they belong to every country. The challenge, of course, is going to be how do we get them, you know, if we don't get them from this level, global level, to the country level, and then to the local level, nothing will really change. And that must happen. So with all of that in mind, you know, having been part of the process, how the experts from academia, from all the world, and the private sector, from civil society, from the governments were discussing what those goals should be, I felt very strongly that early childhood development is such an important field that we need to invest. And as you heard me, I started working on malaria because of children, and that was the same motivation, recognizing that because I worked a little bit on early childhood development earlier, that we have all the evidence why we should be investing in early childhood development. We know what impact it has. We have country studies, money has been invested by multilaterals. The scientific evidence that Maureen was showing is actually not new. We have known it for like 7, 8 years. We have economic evidence, Heckman's study. It wasn't new, but it took us so many years to translate it so that people would understand and show, wow, look, the brain develops differently. Wow, look, it actually has an economic impact and societal impact if we don't invest in early childhood development. So that translation of this important message and being able to be very clear, just showing two things, not trying to show everything, it's too complex, but something that became tangible, people could understand, made the difference. So interestingly, I think it was even 2013 that early childhood development was not really in the goals. It came a little bit late, but it came in, and that was hugely important. So then what happened to my own life is that I have been a board member of World Childhood Foundation in the US, and I was asked to lead the foundation. And I very much respect the work of the foundation, which is really fighting sexual abuse and exploitation of children. And we have 4 offices, so it's Sweden, Brazil, Germany, and the US. But we have worked in over 20 countries and have funded more than 600 projects. So there is a lot of experience because it has been happening over 16 years. And, as a board member, I felt this is such an important issue, but I never really focused on it. So with the Sustainable Development Goals, suddenly I realized, my God, this is such a huge opportunity. And that's why I really wanted you to look at this slide, which actually, without violence, produced. And if you look at the overall impact of violence on economical impact of violence, I think the latest report shows that it's $14.3 trillion. And half of it is children. And, we are talking about sustainable development, but if we don't invest in the foundation, so we did invest in survival, but if we don't protect those investments, by addressing the issue of violence and education, we'll lose anyway. So we do need to pay more attention to that. I also feel very strongly about the numbers. One is there are a lot of people saying, well, these are not accurate, and maybe that's a good study, that's a bad study, and they are old numbers. And they are very often. But guess what? Even as a lapsed basic scientist, I feel like very often we're our own worst enemies. Because in order to push the political agenda or the advocacy agenda, the numbers don't necessarily need to be perfect. We don't need to suggest all the best interventions. We should absolutely, and it's our duty as scientists, work on it, on developing evidence-based interventions and helping with that research, and not just having NGOs not having the capacity or the funds or the expertise to do that. So it's not that's one or the other, but we shouldn't be inactive just because we are not sure if we have the right pieces. Of course, I don't want us to fail and invest money in something wrong when we don't have too many resources, but it is important to act, and perhaps once again, the synthesis and emphasis, or what I would call a prioritization on what we already know works. And maybe that's also at the country level. If each country has to think about that they have to reach the target 16.2 by 2030, and then work backwards, their national plan may look very different in South Africa than it will look in Sweden or in UK or in France. But they may have different interventions, but it's not like we should be stopping the work just because we aren't sure. So I think this is my important message to you. And I definitely sympathize with all the scientists that we need to collect robust evidence. When it comes, and that's perhaps to you, Andrew, as well, if we don't invest in research, or if we don't have good research outcomes, we don't get research funding. I would actually say it's the reverse. Very often, you know, the research is funded, if we look in the US, it's National Institutes of Health. So it's a political priority, or it's citizens' priority where we want to put research money, what we feel is important. And my, challenge was when I started working at the foundation that I tried to look up good papers in good journals on sexual violence against children, and there are not too many. And the reason is because nobody funds that. So in order to have really good research papers, it's very few of them that come out great. Most of the research doesn't really produce always great results. So we need to invest in it, absolutely, but we need to make it a political priority that we need dollars for that. How many minutes do I have left because I left my watch there? 5, thank you. So, once again, those numbers speak for themselves. You see that we have more than 200 million or 275 million children that experience violence at home. And then you see that you have 223 million children that are sexually abused or experience sexual violence every year. So each tells you, what does it tell you? That sexual violence against children is highly more prevalent than we think. When I would ask people how many children or what is the percentage of children in the US that get sexually abused, I must say that most people don't have a clue. I ask pediatricians, I ask my public health colleagues, I ask people who work in development. They don't know. It's not a priority. When I tell them the numbers that it's at least 10% documented cases, wow, they're surprised. If I tell them that in 93% of cases the child actually knows the person, wow. But if I only give them the bad news, they turn off. I think one of the problems is that when you start to address a big problem, and this is not a rare genetic disease we're talking about, this is a universal problem, that of course the risk is higher in impoverished communities or in conflict countries, but it happens in every social group. So once again, this is one of those universal problems that the SDGs are really meant to be universal. It's not something that you just see in certain countries. Except that I must say that I was surprised when I was in Haiti recently and I was asking about sexual abuse of children, and several Haitian people were telling me it doesn't happen here. So acknowledging that you have a problem, or even being able to articulate and understand the scale of the problem, matters. So advocacy, just to even put the problem on the map, is hugely important. And getting people to understand that there are solutions. And I'm not an expert who could tell you what really works best, but there is a number of projects that we fund as Childhood Here. So one of those projects is addressing intimate partner violence. And it's a peer health exchange group, which works in several big cities. We fund them in San Francisco and New York, but they also work in Chicago, and I think they're expanding. And in principle, what they are doing, they train college students in delivering a public health curriculum in modules to high school kids, poor high schools that they know they don't get any really health education at all. And they measure the impact of what these kids are learning about interpersonal violence or sexual violence or drug abuse, and they know that they actually are much more aware about the risks and that they are reacting in terms of deploying what they learned during the classroom hour. And of course, they prefer to talk to someone who is almost their age than to a teacher who comes in. I attended one of those classes, and it's really amazing to see the engagement of youth. But we also fund child advocacy centers. And this is something that's, US is really the base where child advocacy centers started, and it's where you one-stop shop, so to say, when you try to identify if the child was actually sexually abused. And I visited one of the projects, which most likely we will be funding, and it's one of those centers, Safe Horizon, which is in Brooklyn, one of the first child advocacy centers. There's a network in each borough, so in New York, there is roughly more than 9,000 cases disclosed every year. That particular one in Brooklyn has 2,000 kids under the age of 12 because they really don't have the capacity to take more. So they start just kids under 12. So you realize that this is New York. This is a rich city. We have all the possible foundations. We have the number of great NGOs, but we actually don't have a system in place. And what I find challenging when visiting some of the projects is that they barely have any linkages with any academic institutions. So in New York, we happen to have 6 medical centers. We have several medical schools. We have schools of public health. We have teachers' colleges. They are not engaged in that work. So it is hard to produce evidence, but at the same time, you do have resources. Okay, I will stop here. I want to talk about the private sector, but maybe we can hold off.
Great, thank you very much.